Wearmouth, member of the Joint Committee on Vaccinations and Immunisations, retired paediatric consultant too. Maggie, good afternoon to you.
Good afternoon.
Is it over? Do you sense it's over?
I think it's early days to say that. I think hopefully what our epidemiology and statistician colleagues are saying is that it looks like the peak of Omicron maybe past its peak. Things aren't over. It's like climbing a mountain and getting to the top and then realizing you've still got to get down the other side. So fingers crossed, better days are ahead, but we can't take anything for granted at the moment, and particularly not vaccination.
When it comes to, I mean, it is confusing for people. I'm sure you wouldn't dispute that. You know, there's a lot of conflicting information out there. Our politicians aren't always crystal clear. I heard Sajid Javid talking about, really crucial to get the booster, but on the same breath, also talking about how Omicron, really isn't, didn't turn out to be the terrible variant that some at the beginning wondered about, and some even describing it as less than the common cold in terms of its effects. So you can see why some people are confused, Maggie. It's, we've got something that's no worse than a cold, and yet we're still talking about vaccinations and passports.
Well, I disagree that Omicron is just like a common cold. It's not the weakness of Omicron that matters. It's the strength of the vaccination program, particularly those third or booster doses, that really matter. And I can tell you from personal experience, I'm fully vaccinated. I personally had my booster 10 or 11 weeks ago. I went to London for a face-to-face, highly disciplined meeting on Friday. And despite lateral flows being negative and strict restrictions, one of my colleagues tested positive over the weekend and let us know. He was really quite unwell with a high temperature and was very ill. I tested negative on Sunday. And I tested again on Tuesday before I went to work, and I tested positive. So now I am self-isolating.
Right.
And I can tell you that having had my booster, I'm now well. I'm not needing any medication, whereas a colleague who was 20 years younger than me was really quite significantly unwell, probably with the same virus that he passed on to me. So that, my personal experience is that it's the strength of the booster and the immunity it gave to me is the reason I can talk to you now.
So you're saying that the booster meant you still got it. It doesn't stop you getting it, because some might listen to what you just said and say, well, the booster clearly doesn't work because you still got it.
Well, we never said that Omicron could be avoided by vaccination. We said this is serious illness, needing medical attention, needing hospital admission, and causing people to be very unwell. We know that when Omicron came along, that mild Omicron was not going to be affected too much by the vaccine. It's the serious illness and the impacts on the NHS and individuals that it's avoiding. And my personal experience entirely gives that example, that I have hardly felt unwell. I would probably not even have tested had I not been going to work.
But haven't most people with Omicron had a similar experience? They all said it was pretty mild and didn't hit them. I appreciate that if somebody is elderly or vulnerable, it might be a different story. But across the board, generally speaking, that seems to be the way most people have described their experience of getting the Omicron variant.
Well, it can still make you very unwell, make you miss work. It can be really quite an unpleasant experience. And we still know that people are being admitted with Omicron, and people are dying of Omicron as we speak. So, the peak
with it, most people are dying with it, Maggie. That would be fair, wouldn't it?
Pardon?
Most people who die with it rather than of it.
Well, not at the moment. No, people are still being admitted with serious Omicron and are becoming very unwell. You don't have to ask many intensive care people to know that this is affecting people as we speak. But it is mostly the unvaccinated or partially vaccinated people who are being affected.
But that would still be, and again, I'm not going to go down that line of comparing it to flu, but there's some certain synergies, of course, because we are talking about two viruses here, that on any year, if you had flu snaking its way around the place, we would be talking about vulnerable people in hospital with flu, and some of them sadly would be dying.
Yeah, and we have full vaccination programs every year to counter that.
Which doesn't work for everybody, of course.
No, but it does target the vulnerable people, and it helps reduce transmission.
Right.
And we are building up the age ranges of people, particularly children, who are offered the flu vaccine in order to protect them and protect family members.
But they don't. I mean, we could go on with that, could we? Just keep vaccinating the life out of people forever. I mean, do you think that is an inevitability? It's not a loaded question. I mean, is that where we're at? Because understandably, which is why it's an interesting area of this conversation, Maggie, and one I wanted to have with you, is that you can see the confusion when you think of somebody who's, I've had 2 jabs, for example. Why would I need the booster? For what reason would I need the booster?
Because you're not fully protected until you have the booster.
And that would be it, the end of protection for good.
That
for the rest
will
of
last
time.
At least 3 months. We know that. We don't think an extra booster would help, but we are trying to get us through the winter to try and hope that this will help the Omicron numbers decrease, and we can see our way forward as the weather gets better.
But would I hear that, but I mean, does it, that the fact that I, in my existence on planet Earth, that I might get a virus is kind of part of the gig of being a human being, isn't it? I mean, you don't medicate for every possibility and eventuality. Stuff happens on this thing called our planet.
Well, yes, we can't have vaccines and boosters for every single virus. No, of course we can't. But it's the impact on individuals. It's the impact on their ability to look after themselves. It's the impact on health services. It's the impact on the economy that matters.
But if Omicron isn't as dangerous, shall we put it like that, as Delta, for example, then why would the booster be so imperative?
Because the vaccine efficacy, the immunity wanes over time. And that's why you need the booster, to keep your immunity up, to see us through the winter.
But I may have immunity. I mean, what if I've got natural immunity? I mean, I had COVID just before Christmas, so the chances are I probably have. So there would be no need really to have a booster if I've already got the immunity, a booster that couldn't give me perhaps even the level of immunity that I've got naturally.
Well, it wouldn't be a problem to have a booster 28 days after you've had COVID, because natural COVID immunity wanes the same way as vaccine-induced immunity.
So as humans, we should always be immune where possible from COVID. That's the current state of play.
That's the way to get us through this and get the pandemic numbers down, yes. What we do when it is down to lower acceptable numbers and the weight has come off the NHS, which is just bursting at the seams at the moment, then we can have another conversation.
Right.
But we cannot let anything up in terms of vaccination now. We really need to make sure that vulnerable people get it. And these are particularly pregnant or breastfeeding women, or women who are thinking about becoming pregnant. And also, we only have half the number of 12 to 15-year-olds who are vaccinated now. So there are significant groups of vulnerable people who are eligible for vaccines who are not fully vaccinated, as we know now. And these are the people we are trying to target.
Can you understand, though, Maggie, why somebody would listen to this and say, actually, you've just given us a good reason why it doesn't necessarily all do what it says on the tin. And we all know the vaccines work, etc. But to an extent, of course, you are now living evidence that you can have 3 jabs, the booster being the last, and still get COVID, and you're now in isolation. So it hasn't quite done what perhaps people thought it might do. Even if we didn't think it was going to cure it, it hasn't fully done. I mean, you're in isolation, for goodness sake.
Yeah.
And got COVID. But
I'm not ill. And my colleague who'd only had the 2 vaccines was really quite unwell and quite worried about his welfare. I'm not. So I think I disagree. I think it's a perfect example of us saying what it was doing on the tin. It would not deal with mild Omicron, but it would deal with severe and serious Omicron.
Are there any other examples around where somebody is given a vaccine that doesn't stop them getting the illness they're being vaccinated for?
Well, that's the problem with the Omicron variant. It is such a different variant from what we had before. It is little short of miraculous that serious Omicron is dealt with by these vaccines. What we have to decide in the months to come is whether we need an Omicron variant vaccine for vulnerable people later on this year. Those are the kind of decisions we'll be looking at.
So you're saying that Omicron is only mild because of the booster, and if you haven't got the booster, then it's a very different kettle of fish.
Exactly so. Even
though in South Africa, for example, I know it's a younger population on balance, but they haven't had the same level of success with the vaccination and the booster. And Omicron, where it was initially, I know it was probably around elsewhere, but South Africa was the place it was first identified. They didn't seem to suffer this wave of deaths and destruction.
We looked into the South African data, and there's so many different reasons why their population is different in terms of natural immunity, in terms of age, in terms of health services, etc. We decided there was really very little that we could actually do in terms of comparing population data.
Okay.
We have a much older, more vulnerable population here.
Maggie, thank you. Dr Maggie Wearmouth, member of the Joint Committee on Vaccinations and Immunisations, retired paediatric consultant with us here on Talk Radio. Make of